Informational Guide to Choosing the Best Hospice Care. What is hospice care? Hospice care is provided to terminally ill patients who have a life expectancy of less than 6 months. Every patient has the right to die without bodily and emotional pain. The primary focus behind hospice care is making patients feel comfortable, stable, and dignified during their final months of living. In addition, hospice care improves the quality of life for the patients, but it does not help prolong life. Aside from the focus on the patients and their experience, hospice care ensures that their families are able to handle the emotional stress and trauma that is related to death. Curative treatment is an approach in which the goal is to cure the disease and to prolong life at all costs. Palliative care is not curative in nature but is designed to relieve pain and distress and to control the symptoms of the disease. Symptoms that palliative care focuses on relieving include pain, nausea, vomiting, constipation, anorexia, malnutrition, dyspnea or air hunger, psychological and spiritual issues, weight loss, dehydration, weakness, risk for skin impairment, depression, sleeplessness, and insomnia. Patient and caregiver education. The way hospice care is planned should affect the patient and caregiver in an honest and straightforward method. It is thought that the fear of the unknown is always greater than the fear of the known. Educating the caregiver in symptom management, hands-on care of the patient, caring for body functions, and teaching regarding the signs and symptoms of approaching hospice patients are important to relieve fears. How to initiate hospice care. Admission to a hospice program is the decision of the patient and their family, because not all people need or desire hospice care. Autonomy is one of the attributes of quality healthcare. The patient or family should be the center of all important decisions taken in regards to the patient's care, and there shouldn't be any decisions made without consulting the patient or their family first. Objectives of hospice care. Managing symptoms and improving the quality of life without life-prolonging measures is a main objective of hospice care. Allowing the patient and caregiver to be involved in the decisions regarding the plan of care is a primary aspect of hospice care, as well as encouraging the patient and caregiver to live life to the fullest. Other objectives include providing continuous support to maintain patient/family confidences and reassurances to achieve these goals, educating and supporting the primary caregiver in the home setting that the patient chooses, and providing a clear understanding of death-related issues as it affects much of the performance of caregivers and the quality of hospice care. Pediatric Hospices. 81 million children in the United States require pediatric hospice care. In the United States alone, there are 2.5 million deaths annually. About 50,000 deaths are pediatric, 0 to 19 years old, 2.2%. Children represent 25% of the U.S. population. Half of childhood deaths are in the first year of life, while half of infant deaths are in the first month of life. Pediatric palliative care diagnosis. There are conditions for which curative treatment is possible but may fail. The following are common diagnoses in children, which make them eligible to receive hospice care. Genetic/congenital, 40%, neuromuscular, 40%, oncologic, 20%, respiratory, 12%, gastrointestinal, 10%, cardiovascular, 8%, advanced or progressive cancer or cancer with a poor prognosis, complex and severe congenital or acquired heart disease. Models of care. Hospice care can be provided in the following settings and situations: inpatient consultation palliative care teams, inpatient palliative care, home hospice, perinatal and neonatal hospice, concurrent care, respite. Hospice families support and know what the hospice provides. Hospice care includes a diverse range of services and forms of medical care. The care is done through daily activities to minimize the stress for patients and their families. Among its major responsibilities, the interdisciplinary hospice team manages the patient's pain and symptoms. They also assist the patient with the emotional, psychological, and spiritual aspects of dying. The interdisciplinary team provides the necessary drugs, medical supplies, and equipment, and they teach the family on how to care for the patient outside of the hospice. In addition, they deliver special services like speech and physical therapy when needed. They also make short-term inpatient care available when pain or symptoms become too difficult to treat at home, or when the caregiver needs respite. And lastly, they provide bereavement care and counseling to the surviving family and friends of the patient. A great team can make the difficult time easy. Hospice care has diverse aspects and it requires a wide range of services. A multi-professional health team works together in caring for the terminally ill patient. They develop and supervise the plan of care in conjunction with all of those involved with the care. The interdisciplinary team considers all aspects of the family unit, providing support to both the dying patient and to the caregiver. The patient is included in all decisions and care planning because the care provided is patient-centric. Medical Director. Every hospice should have a doctor of medicine or osteopathy. They are known as the medical director and they assume the overall responsibility for the medical component of the hospice patient's care program. They act as a consultant for the attending physician and they serve as a mediator between the interdisciplinary team and the attending physician. The medical director plays a major role in creating successful teamwork. Nurse Coordinator. Every hospice should have a registered nurse who coordinates the implementation of the plan of care for each patient. They are in charge of performing the initial assessment, admitting the patient to the hospice program, and developing the plan of care along with the interdisciplinary program. The nurse coordinator also ensures the plan of care is being followed, and they coordinate the assignments of the hospice nurses and aides, facilitate meetings, and determine the methods of payments. The nurse coordinator is vital in controlling the quality of care. Social worker. Social workers evaluate and assess the psychosocial needs of the patient. They assist with community resources and filing insurance papers. They also support the patient and caregiver with emotional and grief issues. In addition, social workers assist with counseling when communication difficulties are present. The role of social workers helps in bridging the gaps between the patient, family, and the hospice. Spiritual Coordinator. Spiritual coordinators must have a seminary degree but can be affiliated with any church. The spiritual coordinator is the liaison between the spiritual community and the interdisciplinary team. They assist with the spiritual assessment of the patient and they work closely with the family to maintain their beliefs. They also develop the plan of care regarding spiritual matters. In addition, they assist the patient and the caregiver in coping with their fears and uncertainty. Lastly, they assist with funeral planning and performing funeral services. This role is very important for maintaining the public image of the hospice company. Volunteer Coordinator. The volunteer coordinator must have experience in volunteer work. They are responsible for assessing the needs of the patient and caregiver for volunteer services. They provide companionship, caregiver relief through respite care, and emotional support. Volunteers may read to the patient, sit with the patient, or do grocery shopping or yard work. Volunteers can improve the quality of life by spending more time on things which are not directly related to medical care. Bereavement Coordinator. This position requires a professional who has experience in dealing with grief issues. They assess the patient and caregiver at admission to the hospice program and identify risk factors that may be of concern following the death of the patient. They follow the plan of care for the bereaved caregiver for at least a year following the death. They may also provide counseling or refer to other counseling resources. Hospice Pharmacist. Every hospice should have a pharmacist who must be a licensed pharmacist and must be available for consultation on the drugs the hospice patient may be taking. The hospice pharmacist evaluates for drug-to-drug or drug-to-food interactions, appropriate drug doses, and correct administration times and routes. The pharmacist holds a key role in preventing medication errors and provides patient counseling related to medication errors. Dietitian Consultant. The Dietitian Consultant should be a licensed medical nutritional therapist, LMNT, and should be available for consultations and for diet counseling. The hospice nurse does nutritional assessments at admission. If nutritional problems are noted, the patient may be referred to an LMNT. This role is very important to improve the quality of life of the hospice patient. Hospice Aide. Hospice aides should be certified nurse assistants who are supervised by the hospice nurses. They are responsible for following the plan of care developed by the interdisciplinary team. They assist the patient with bathing and personal care. They may also assist the patient or caregiver with light housekeeping services. Other service providers. The hospice team may also have some other professionals if needed, which may include the following positions: physical therapist, speech and language pathologist, occupation therapist. These positions are not for rehabilitative services, but may be necessary to assist with improving the quality of life and care for the patient and caregiver. The hospice's responsibility after a patient's death. Bereavement period. Hospice care does not end once the patient dies, but usually continues for at least 1 year with bereavement support. Even though the family feels they have prepared for the death, facing the future without the person who died is difficult. The hospice staff also goes through a grieving period for each patient who dies. Each hospice provides support to their staff with support meetings and time to vent their feelings and to heal. This role of the hospice is vital to keep society stable and healthy after losing the people who have had an effect on people's lives. Ethical issues in hospice care. Hospice care is complicated as it involves many ethical decisions throughout the care from the period of the enrollment of the patient to the end of their care. Ethical issues when dealing with hospice patients include withholding or withdrawing nutritional support, the right to refuse treatment, and do not resuscitate DNR orders. It is hoped that the patient's wishes are made known in advance, such as a living will or an advance directive, or that a durable power of attorney has been appointed. It is imperative that the nurse is aware of the organization's ethical policies and procedures so that any questions and concerns may be addressed appropriately and correctly. Quality care at the end of life. It is the patient's right to receive the quality care at the end of their life. Feedback from family members, patients, and employees through surveys and inspections can be used as sources to develop and improve future hospice plans. It is extremely important to have a quality assurance program in place to minimize errors. Hospice Performance Reports. The National Summary of Hospice Care published the following reports, which can be helpful in determining hospice performance. NHPCO Performance Measure Reports. NHPCO members also have access to national-level summary statistics for the following NHPCO performance measurement tools. Patient Outcomes and Measures, POM. Pain relief within 48 hours of admission. Avoiding unwanted hospitalization. Avoiding unwanted CPR. Family Evaluation of Bereavement Services, FEBS. Survey of Team Attitudes and Relationships, STAR. Job Satisfaction, Hospice Specific, Salary Ranges, Provider Level Results.